afternoon, everyone. Outcomes of pan-retinal photocoagulation in patients of diabetic retinopathy. The prevalence of diabetes in urban India is 15% and is 19%, and rural is 15%, which is relatively higher to that of the world. The risk factors are modifiable and non-modifiable. The modifiable being glycemic control, hypertension, dyslipidemia, and non-modifiable being the duration of diabetes. The DCT study showed that 75% of reduced risk of development of diabetes with tighter HbA1c control. The prevalence of diabetes. Next news. In 2016, a study done by Mukhtar et al., where 67 eyes of patients of PDR were included and CMT and BCVA were documented. The mean treatment BCVA pre-treatment was 0.67 and post-treatment was 0.57, and CMT measured on OCT pre-treatment was 391 micrometers and after treatment was 316, which showed. So the research question arose that what would be the outcomes of diabetic retinopathy, and that is what we did to help in patient counseling. So the objective of the study was to study these functional effects. Ours was a descriptive study done on adults above 30 years of age over 1 year after ethics approval from GMC Amritsar, done in the Department of Ophthalmology at RIO Amritsar. So we included all patients above 30 years with DR of any gender undergoing PRP for the first time and willing to enroll in the study. Exclusion was not willing to participate and with advanced lenticular opacities or prior treatments and with cognitive impairment. So the detailed clinical examination was done. Visual acuity by Snellen's chart, refraction, and BCVA was noted. Slit lamp microscopy of the anterior segment was done. Posterior segment was done with indirect ophthalmoscopy with 20D and slit lamp with 90D. IOP was done by GAT, and OCT was done by NIDEC RS330 for macular map scan. So pan-retinal photocoagulation was done in patients as per the protocols of the hospital with 532 nanometers Nd:YAG slit lamp delivery system and quadricepheric lens. Regular follow-ups at 1 month interval done for 3 months and then 6 months post-laser. During each study, the patient was evaluated under the standard ophthalmic exam of visual acuity, IOP, and OCT. So we did stats using MS Excel, and out of 32 patients, 62.5% of patients were males and 37.5% were females. Maximum patients were in the age group above 60 years, and 87.5% of patients had PDR and 12.5% had very severe NPDR. We measured the outcomes in terms of visual acuity and CMT. The visual acuity on logMAR before intervention was approximately on an average 660, and after intervention at the end of 6 months was 6.9, and there was a 72% improvement in patients. The central macular thickness post-intervention improved by 29%. The pre-treatment was around 405 microns and post-treatment went to 287. The clinical implication of our study was that there are desirable outcomes in visual acuity and central macular thickness, which helped in better understanding and patient counseling for tighter diabetic control and better HbA1c control. So, and the demerits were that long-term side effects of PRP could not be evaluated due to loss of follow-up and shorter duration of the study. Thank you.